Hi, I'm Dr. Heather Bartlett. I'm the lead physician and the founder and owner of MetaboLab, your biohack. We're a clinic that's focused on metabolic health, longevity, and aging well. And here's what you need to know about me. I take the practice of medicine very seriously. I had the privilege of being born into a healthcare family. My dad was a doctor, my mom was a nurse, my sister is a nurse JD. I have numerous cousins that are also physicians and surgeons. You could say healthcare kind of ran in most of our blood. My background is I'm a Texas A&M University, College Station, Texas graduate, Bachelor's of Science in Biology. After graduating with my Bachelor's of Science in Biology, I went to St. Matthew's University in Grand Cayman. During those years of medical school, I actually had the privilege of also being taught by University of New England osteopath professors. So basically an accidental American medical experience in the United States while I was working on a master's in healthcare administration at St. Joseph's College in Maine. After I graduated from medical school, I had an internship in general surgery at the Jewish Hospital in Cincinnati, Ohio. I was a general surgery preliminary intern, meaning I had a 1-year contract. At the end of that 1 year, I had to decide what I wanted to do next, and I elected to go into family medicine. I completed my family medicine residency as a chief resident at Mount Carmel in Columbus, Ohio. And I thought that Seattle, Washington would be my forever home, so I took a job doing outpatient employed family medicine in Seattle. I made the decision that I wanted to work back in the emergency room, and I moved back to Texas, and I decided I wanted to work at a higher acuity emergency room and took a job in Huntington, West Virginia. I decided I actually really missed Columbus, Ohio, and it needed to be possibly my forever home. And so I moved back here and took a job doing pre-admission testing. I'm telling you all of this because I was already seeing somewhat the cracks in the healthcare system and people's dissatisfaction and how they felt and the words that they would use when they would come in and what they were hoping for, but it wasn't aligning with what they had been taught to how to interact with their doctor or to explain how they're feeling to get the outcome that they were hoping for. So after working in the urgent care, again, taking more mental notes, that's when I decided to open my direct primary care practice. That's where I got to really understand the need for aggressive lifestyle change. Only I couldn't implement it then because I wasn't offering the testing. I didn't have the picture of what needed to change. I had my direct primary care practice for about 4.5 years, and towards the last couple of years of it, had already started thinking there needs to be a different type of clinic. So after years of contemplating and researching and investigating what other tests are out there that answer the questions that I wanted to answer for my patients in that practice that I couldn't then. That's how this clinic was born.